Hello, my name is Terry Frager, and I am a Medicare counselor with the SHINE program here in Sioux Falls, South Dakota. SHINE stands for Senior Health Information and Insurance Education, and we help people with Medicare, all aspects of education, and pointing them to the plans that will help get them set up on Medicare to help them achieve all that they want out of Medicare. I am going to start with a slide program that I put together. So we will, and I'm trying to figure out there. Okay, there we go. Understanding Medicare. Now, Medicare is kind of a big field, and people get confused thinking they have to understand everything about Medicare before they can get started in it. And that is absolutely not true. I kind of think of it in the steps you need to take in order to get going. So what is Medicare? Well, it's health insurance for people 65 and older. That's where most people get involved with it. But there are some situations under 65 with certain disabilities. ALS is one of those, Lou Gehrig's disease, and without a waiting period, and any age with end-stage renal disease or kidney failure. But if you're on disability income, after 24 months, they will want to put you on Medicare and get you started moving that direction. So where do I find out information about Medicare? Well, as you can see on the screen, there's a nice little book called Medicare and You. And Medicare and You is really the Bible for Medicare. And you can find that at medicare.gov. And you can actually download the copy, or you can request a copy to be sent to you, or you can call 800 Medicare and request a copy sent to you. You can come to SHINE at our website, SHIINE, shine.net, and check us out there for that publication as well. So a note down here at the bottom, to get Medicare, you must be a U.S. citizen or lawfully present in the U.S. You must reside in the U.S. for 5 continuous years. So what must I do to get enrolled in Medicare? Okay, so here is step 1. Get enrolled in Medicare. If you aren't automatically enrolled in Part A and B, then you need to enroll with Social Security. Now, it seems really strange that you go to Social Security in order to get enrolled in Medicare, but there are reasons for that. So you need to start at socialsecurity.gov. There is actually an online application, very easy to use. Fill out your information and send that in. If they have any questions, they'll contact you, or you can call the 800 number for your local Social Security office. Set up an phone interview, and they will be glad to get you started on Part A and Part B, or just Part A, depending on what you want to do. So the age for full Social Security retirement benefits is increasing. However, Medicare eligibility is still at 65. When can you sign up for Medicare? Now, if you don't already have Medicare, then as you're approaching age 65, you can start 3 months prior to the month that you turn 65, and then you have 3 months after that month that you turn 65. So 7 months total to get all of those different parts of Medicare going for you. That's called your initial enrollment period. So what if I missed that for some odd reason? Well, there is a general enrollment period each year that starts from January 1 through March 31. There is an open enrollment period from October 15th through the December 7th. So you have several different times there. Plus, they allow special enrollment times. Now, for many people, if you are planning on working and you have good medical coverage at work and they aren't forcing you to go ahead and take Medicare, then you don't need to take Medicare. A lot of people at this point, when they turn 65, would go ahead and take Part A, because for most people, Part A is free. And so they can have that backup coverage for hospital. And then when they are retiring and quitting work, and also their coverage would disappear, then that is a special enrollment period for them to start Part B, and get the rest of their Medicare things going. So what are the parts of Medicare? Now, people get confused between parts and plans, and you'll see them mix those up all the time. But parts are the basics. And so the basics of Medicare are Part A and Part B and Part D. Those are the basic parts. Plans refer to insurance policies. We'll talk more about those later on. Part A covers all of your hospital, inpatient, things like that. And Part B will pick up the doctors and a lot of the other outpatient things that you'll want to do. Part D covers the prescriptions. So step one, get enrolled, Part A and B. And then you have step two, which is make a decision. And this is where people get confused a lot between going with original Medicare or Medicare Advantage. So original Medicare is essentially Part A and B, and you can add Part D for the drugs. We have to keep in mind that Medicare is not going to pick up the total tab. They're only going to pay 80% of any of the things that you get done. And so we have to have something to pick up the rest of that 20% and some of the other costs. So they call that supplemental coverage or Medigap. And I'm sure you've heard of the Medigap. And so you can have a Medigap policy that will pick up all of the other costs that are included. Now, the other option is to get a Medicare Advantage plan. And every advertisement you hear on TV is a Medicare Advantage plan. And you need to look real close, even when they send them to your home, because you think it's Medicare and it applies to all of Medicare, but no, this is an Advantage plan, and they're a little bit different. The Advantage plan is an insurance policy similar to the Medigap, but it tries and takes Part A and B and D and throws in some extra benefits and puts that all together in one policy. And so it fits the needs of a lot of people. And some parts of that is a lot cheaper than the other. So let's keep all of that in mind. But this is probably the difficult thing for step two. We have to decide between original Medicare or Medicare Advantage. Now on this slide, we kind of put them side by side. Original Medicare, you can go to any doctor or hospital that takes Medicare anywhere in the United States. You can be traveling all of the time if you want. And wherever Medicare is accepted, Medicare is going to pay 80%, and your supplement will step up and take care of the rest anywhere you go. And in most cases, you don't need a referral to see a specialist. Now, Medicare Advantage is quite different, because you'll need to see the doctors and other providers who are in the plan's network and service area. Keep in mind those two things: network, service area. A network, they could pull together certain doctors and hospitals and clinics that will work with their plan. That's their network. If you want the best pricing, you need to go to those doctors, clinics, and hospitals. So you have to work with their network, and you have to stay within their service area. And you really need to ask questions about both of those. What doctors are in your network and clinics and specialties and all of that, and how big is the surface area? So from where we're at, right on the border with Minnesota, and just about every insurance plan is approved by the state of South Dakota. So if I go across the border into Minnesota, am I outside of the service area? That is an important question to ask. Also, you may need to get a referral to see a specialist. Your general practitioner, your basic doctor, is really kind of the gatekeeper for the plan. So quite often you have to ask him first if he can be recommended to go see a specialist. So keep that in mind. Next page. Original Medicare covers most medically necessary services and supplies in hospitals, doctors' offices, other healthcare settings. Wherever Medicare is accepted, which is just about everywhere, then you can get coverage. You can also join a separate Medicare drug plan to get the drug coverage. So Part A, Part B, Part D, and Medigap. That's original Medicare. The Advantage plan has that all put together in one policy, including extra benefits that original Medicare doesn't cover, like some, heavy on the some, vision, hearing, and dental. Again, just because it says it has a benefit, you really have to question, well, how much is that going to cover? Now, so one of the things you might want to do with a Medicare Advantage plan that you're looking at is to call up your doctor, dentist, whatever, and don't talk to the doctor because they usually don't know about the billing side of it. Ask for billing. Go into the billing side, and because they're the one that has to fill out the forms that go there. So they usually have a pretty good idea how well Medicare Advantage plans cover. And so you can get a good idea there. Okay, and now drug coverage. There are some Medicare Advantage plans that don't have drug coverage. So therefore, to get drug coverage, you have to go to Part D and get one of those. Okay, let's go a little deeper into the Medigap policy. So we're back on the original Medicare side. They're sold by private insurance companies, which is the same for every Medicare Advantage plan and every Part D plan. They're all separate individual insurance companies and policies. And the Medigap policies fill in the gaps of the, excuse me, of original Medicare. They cover deductibles, coinsurance, and co-payments. So this policy is picking up and covering deductibles, coinsurance, co-payments. Now, the deductible for Part A is $1,484. So it's really kind of nice that they step up and cover that and cover co-payments. So with Medicare Advantage plans, I can assure you that about everything has a co-payment with it. Now, all plans under the Medigap policies, all plans with the same letter have the same coverage, but the costs are different. Now, again, Medicare has set out coverage for these plans or guidelines, and every one of these policies has to fulfill those guidelines. They all have to cover the same things. Costs are different. So when, unlike other insurance, trying to compare policies is difficult, here they all cover the same thing. So what you want to do real quick is find the bottom line, because that tells you what's going on. Plans are different in Minnesota, Massachusetts, and Wisconsin. Now, this is maybe kind of a confusing graph here, but over on the left-hand side, you can see benefits. And that tells you what is going to be covered, like Medicare Part A coinsurance, hospital costs. Because in the hospital, Medicare pays so much for the first 20 days. And then it drops how much it's going to pay off of that quite a bit for from then or out. So it's great to have a policy that steps up and picks up all of that. Medicare Part D, coinsurance and co-payments, blood Part A hospice care, coinsurance, co-payments, skilled nursing facility care, coinsurance, and on and down. Now, so what am I looking at? Well, as you look at each one of those categories under the letter, then you can see it, a lot of 100%. Now, the one that has the most 100% is Plan F. Plan F was stopped last year, 2020. So we no longer have Plan F. So the next best one to cover everything is Plan G. And you'll see down at the one gap it has is on Part B deductible. The Part B deductible is $203. And so that's a one-time $203. Once you pay that, then policy covers everything else. So what's the best time to buy Medigap coverage? Of course, in your first initial enrollment is the best time to go ahead and start that. Now, during your Medigap OEP, that's open enrollment period, insurance companies can't, number one, refuse to sell you any Medigap policy they offer. 2, they can't make you wait for coverage. And 3, they can't charge more because of past or present health problem. We call that guaranteed issue right. In other words, you are guaranteed to be issued that policy at the price they have for everybody else. And that is important because they can't take a look at your past and charge you more, or just decline and say, no, we don't want to take care of that person. So you can also buy a Medigap policy whenever a company agrees to sell you one. So let's go on to prescription drug coverage, Part D. It is an option benefit available to people with Medicare. Again, it's run by private insurance companies that contract with Medicare. And they cover both original Medicare and the Medicare Advantage plans. How does it work? Number one, it's optional. Optional. You can choose a plan and you can choose to join. And I have dealt with a number of people who say, well, I just don't take any medications. So I don't want to have to pay a premium for something I'm not going to use. Well, if you don't start it during your initial enrollment period or special enrollment period, then you may have to pay a lifetime penalty if you join late. So you don't need any medications now, but 10 years later, you really have a doozy of some, and now I need that plan. Now they say, okay, we'll sell you the plan, but there's a 1% penalty for every month that you didn't take it back when you should have. And that stays with you for life. So keep that in mind. Drug plans have formularies, which is essentially a list of covered drugs. Now, they must include a range of drugs in each of the main categories of medications, and they are subject to change. So just because that formulary has every category, it may not have the medication you need. And so you have to check around with different plans and see which one is covered by that. Now, subject to change. Every year, just about, they are going to change something. So in September, they will send you a letter outlining the changes that they're going to take place on January 1. You need to read that letter. And then October 15th is the first day that you can take a look at all of the plans and see if there is one better than you have currently. We actually, we have volunteers that help people do that. We work with that as well from October 15th through January 7th. So you can call the Shine office and get set up with an appointment. we actually use the plan finder on Medicare.gov. And so you can go there as well. Where it really works best if you, while at Medicare.gov, you take a minute and set up an account, because that gets you into all of your information on Medicare. And then when you use the plan finder, it has all of your drugs and everything already loaded and all of your information in there. So when you find the right plan and you hit that enroll button, then it just kind of steps you through things. And I think about the only thing you ever have to put in is the person's phone number. And then it gives you, so you can find the best plan for you, and that'll start on January 1. So every year, take a look. Your out-of-pocket cost may be less if you use a preferred pharmacy. You can choose the number of pharmacies that you want to look at and compare. There's 3 ratings: preferred, standard, out of network. Of course, out of network simply means full price. They don't cover anything. Excuse me. So preferred and standard. Preferred is a lot cheaper than those that are standard. So again, you'll check and you can tell which one is going to be the cheapest thing for you. If you have limited income and resources, there's extra help to pay Part D costs that comes through the Department of Social Services, and it is a great program. Medicare Advantage plans, or Part C. They're offered by, again, Medicare approved private companies. If you join an Medicare Advantage plan, you'll still have Medicare, but you'll get your Part A hospital insurance and Part B medical coverage from the MA plan, not original Medicare. And so what that basically means is when you go in a doctor's office, you don't have to put down your Medicare card and your supplement card. You just have to put down your Medicare Advantage plan card, and then that will take care of everything else. How do they work? Is a Medicare Advantage plan for you. So you are still in Medicare with all rights and protections. You still get services covered by Part A and Part B. You may choose a plan that includes prescription drug coverage. You can be charged different out-of-pocket costs. Now, that's the one thing to keep in mind. There is a total out-of-pocket cost number with each one of those policies. And I've seen a lot of them up in the $6,000 range. So they say after that, then we pay everything else. So you might want to figure that into your monthly premium as well. You can't be charged more than original Medicare for certain services like chemotherapy, dialysis, and skilled nursing facility. You may choose a plan with extra benefits like vision, dental, or fitness and wellness benefit. And you have a yearly limit on your out-of-pocket costs. So again, how do they work? Each plan has a service area in which its enrollees must live. And you or a provider acting on your behalf can request to see an item or service. Well, if it will be covered by the plan in advance, it's called an organization determination. So just contact your plan for more information. Medicare pays a fixed amount for your coverage each month. The company's offering Medicare Advantage plans. Each plan can have different rules for how you get your services. So again, check those out, and those rules can change each year. But if they're going to change the rules, they'll send you a letter telling you. Hospice care is covered, but that is covered by original Medicare. When can I enroll in a Medicare Advantage plan? Well, you can do it, of course, in your initial enrollment. You can take care of that right off the bat. You can take care of it in open enrollment, October 15th through December 7th. You can take care of it in Medicare Advantage open enrollment period, or general enrollment, which is January 1st to March 31st. So during those timeframes, you can switch from one Medicare Advantage plan to another just by the click of a button. If down at the bottom, note if you drop a Medicare supplement insurance or Medigap policy to join a Medicare Advantage plan, you may not be able to get it back. So what's that say? So if you started out with original Medicare, where you've got A, B, D, and a Medigap policy, and you decide during one of those enrollment periods, I want to switch to a Medicare Advantage plan, you can do that. They'll let you do that. They'll actually let you switch back. But they're saying the first time you got that Medigap policy, you had guaranteed issue. You may not have guaranteed issue. So before you make that decision to go back, you need to contact a Medigap policies and see if there is one of those that will accept you with guaranteed issue. There are several that do, but again, make sure before you leave. Key points to remember. Medicare is a health insurance program. It doesn't cover all of your health care costs because it only covers 80%. You have choices in how you get your coverage. You can go original Medicare, you can go with Medicare Advantage plan. If you choose one and don't like it, you can switch back to the others. So some people are so afraid they're going to make the wrong decision up front. And Medicare says there are no wrong decisions. You choose that, you can make a different choice. There are programs for people with limited income and resources through the Department of Social Services. And those can greatly affect what you're paying. Now, your decisions affect the type of coverage you get. So again, choose carefully, choose thoughtfully. And if you want, you can bounce it off of people at Shine. And certain decisions are time sensitive. Each one of the programs, depending on what you do, can have a penalty for not enrolling at the right time. And usually that's surrounded by the whole thing of credible coverage. If you already have credible health coverage and that's continuing, then you can wait to enroll. If you don't, then some of those penalties start incurring. So I know we've gone through a lot of things, and it may have cleared up a few things and caused a few more questions. Feel free to continue to check us out. There's always Medicare.gov and 1-800-Medicare, where you can get your questions answered as well. I thank you very much.